I suffered tremendously from the lack of sleep and the tremendous coughing.
Terrible, and also you couldn't eat properly. You're just a very poorly man.
The only way I could sleep was I would get up in the night and I would go and I'd sit in a recliner chair in the lounge, and that was the only way I could get sleep. And this went on for 8 months.
I would think so.
Before I actually found myself on the TAVI path.
I didn't know there was anything wrong with me at all. I was away in the Lake District on a walking bridge weekend and had a really, really bad night with awful chest pains, which went on for 2 or 3 or 4 hours.
I didn't even go out very much because I just didn't have the, shall we say, the get up and go any length of walk. Might walk down the street a few yards, but then I would soon come back again and come back into the house and sit in my chair. And I suppose this went on for quite some time.
I was shocked that there was anything wrong with me because I thought I was reasonably fit, had an active life, played golf, everything. So I came home, I drove back and spoke to a doctor friend of mine who said, I think you should go down to A&E. They put me in a wheelchair and didn't let me walk again until they'd done all the tests. And that's when I found out that I had something wrong with my aortic valve.
So the aortic valve is the structure which separates the heart from the rest of the body. And that valve is a sort of thin, 3 leaflet, very thin leaflets, kind of like rose petals. And it's supposed to open to let the blood out of the heart, and then it's supposed to close to stop blood falling back in.
Aortic stenosis is a common condition, particularly in older people, but not always, where the aortic valve, which is the main valve through which the heart pumps blood to the body, has become narrowed and restricted so that it's not opening properly to let the blood out.
The most common symptom by far is breathlessness. Less common is chest pain and occasionally dizziness or lightheadedness when patients are walking or trying to exert themselves. Occasionally people present with a collapse or a blackout, and sometimes patients present really very unwell with advanced breathlessness and symptoms of heart failure.
After the symptoms present and the doctor notices a heart murmur, usually with the stethoscope, then that leads to an ultrasound scan of the heart or echocardiogram, and it's that's the key test in making the diagnosis of aortic stenosis.
This places jelly on the chest and uses the sound waves to assess the opening of the aortic valve. Now, if you've got any questions about things, then obviously feel free to ask any member of the TAVI team, and we'd be more than happy to help answer them.
If you have any questions, please raise them with the TAVI team.